All right, good morning, everyone. We're going to go ahead and get started because there's a lot of information today. Um, for those of you that don't know me, my name is Susie Seitz, and I am the Waiver Support Coordinator Liaison for the state office. Um, Today, I'm here once again with the wonderful Miss Opal Ringo, who is a training and research consultant here at the state office and has put together another wonderful presentation for you. Firstly, we do need to do just a little housekeeping. Please note that there are handouts attached to this webinar that you can download. If you have any questions, please feel free to use the questions box and we will get to them as we can. If you are joining us today for the in-service credit, we do have the post-assessment test that will be given at the end of this training. I will drop the link into the chat box at the very end. So please be sure that you stay until the end to receive that information. And as always, this presentation will be recorded and will be posted on the APD website as soon as we can. So now I will pass it over to Opal.
Thank you, Susie. Good morning, everyone. It's good to be here with you all again today. As Susie mentioned, I'm a training and research consultant, and I'm in the Bureau of Consumer Supports at APD. My area of focus is supported living, supported employment, and adult day training. This webinar is a follow-up to the one that we did together on October 28th, where we gave a general overview of supported living. If you did not attend that webinar, it is available on our website. Uh, so today's webinar, we're going to talk a little bit more in depth about supported living, health and safety, uh, making sure that we are doing everything we can to support our clients in the areas of health and safety. And we're going to be answering some of the questions that were raised last webinar. And if you did attend, last webinar, you may have heard the voice of my one of my leaders in the Bureau of Consumer Supports. Her name is Liesl Ramos. Liesl, if you would mind, introduce yourself.
Sure. Can you hear me?
Yes, ma'am.
Okay, wonderful. Good morning, everyone. I am Liesl Ramos. I am a program administrator with the Agency for Persons with Disabilities in the Bureau of Operations. We're in consumer supports, and our area of responsibility includes managing our waiting list, in addition to specialized services such as supported living, supported employment, ADT, and transportation. That's what we cover in our area. And I'm happy to be here with you today.
Thank you, Liesl. And Liesl may help a little bit at the end of the presentation where questions may come up. So we're glad to have her here today. And we're going to go ahead and get started on take a look at our agenda. The first thing we're going to talk about is what our objective is here today. We're going to talk about choice versus significant risk, what that means when it comes to the clients that we serve. Face-to-face visits and what are we looking for during those face-to-face visits. Emergency preparedness, medication administration, preventing financial emergencies, and then we're going to get into some of those frequently asked Q&As that we received either during our last webinar or that we receive in general. So those are going to be our topics. We really want to get into the health and safety questions and things that we've been seeing that we want to help you guys to be aware of. So today's objective, as I said, is to provide waiver support coordinators with the information needed to help safeguard the health, safety, and well-being of APD clients in supported living. That's our goal here today, giving you that information that you need to be vigilant safeguards. And when I say vigilant safeguard, what that means is you, as a member of the client circle of supports, working to help identify and address any potential risk, concerns, uh, any issues that pose a threat to the client's health, safety, and well-being, being very vigilant, being very diligent about addressing those concerns and understanding really what to look for, and understanding that our goal, it is essential that clients receive the health care and support needed to maintain a good standard of living. Now, this is not your sole responsibility, but as a member of that client's team, that circle, we all must be vigilant safeguards to help ensure their safety and health in the community. So the first section that I want to cover is choice versus significant risk. If you guys remember last time, we talked about the philosophy behind supported living, the services, or like what is it all about? And we talked about how the services are person-centered, and how the person receiving the services, that is our client. That's the person that we are trying to please and make sure that they're satisfied. We talked about the person's voice being heard. But another important thing is we talked about their choices being honored, and stating that their health and safety needs must be maintained. But when those two things, what happens when these two things maybe collide, or what happens when a person's choice might pose a risk to their health and safety? What do we do about that when we're trying to make sure that both things are met, that their choices are honored and their health and safety is maintained? So let's talk about the dignity of risk. We as human beings, we all have the right to make choices and experience life. And with that experience comes a certain amount of risk. Some of the choices that we make in lives, they bring about risk to us. And the dignity of risk requires that us as supporters of our clients, we support them as they direct their own lives and they experience both successes and failures, which basically means that they should have the opportunity to make choices that may seem like a risk to us. And they should have the opportunity, just like every human being, to be able to have successes and failures in life. Some of the choices that we've made in lives, our parents may not have thought were the best choices, but sometimes those experiences help to shape us to be the people that we are. So every choice we make is not always going to be the best choice in our lives. And we are not, as a support system, designed to make sure that the client makes the right choice every time in their life. We're there to support them in their own choices. The only time that we would want to step in is if those choices cause endangerment to their lives. So that's when we would step in. A vigilant safeguard is going to help ensure that the client have opportunities to experience their choices without endangerment. So choices should be in balance with an acceptable amount of risk, and they should never pose a significant threat to the client's health, safety, or well-being. If they're making choices that pose those kind of risks, that's not something that we can stand by and watch. If they're making choices to, for example, live in an unsafe place, to live in filth, or to smell bad, or to inflict self-harm, those are the times when we step in. And this is a quote attributed to John O'Brien from Responsive Systems Associates. He's done a lot of work in our field. And on your resource handout, you'll see some links to some resources from John O'Brien. But he says, choice is not a reason for a person to live in an unsafe place. Choice is not a reason for a person to live in filth. Choice is not a reason for a person to smell bad. And choice is not a reason for a person to inflict self-harm. So we can't stand by if someone is doing something that is going to significantly cause harm to their health, safety, and well-being. We couldn't stand by while someone says, well, I'm gonna jump onto train tracks and there's a train coming. So that's not a choice. That's a putting themselves into a significant risk. And so when we have clients and we're hearing the choices that they want to make, a good question to ask ourselves is, does this choice pose a significant risk to the client's health, safety, and well-being? And if the choice does, then that's when we have to step in and address the situation. So now let's talk about face-to-face visits. And I will say one of the biggest questions that we often receive is how often are we supposed to visit the clients when they're in supported living? It's once a month. I know it's definitely in the handbook, but has been some confusion with that. There, you have to see that client at least once per month. It does not have to be in their home. It has to be in the home at least once per quarter for that quarterly visit / quarterly meeting. But every month you want to be laying your eyes on that client in supported living. And because you don't have to see them in the home on every visit, it's probably best practice to observe them in the places that they frequent so you can get a better understanding about how their lives are going. So for example, if they go to an ADT facility, if they have a job, all of the things you may want to be able to see if you can observe that client in the different facets of that client's life. Okay. So what are we looking for when we're making these face-to-face visits? The biggest or key question, a key question that you want to answer is, how's the client doing? That's what we're looking to make sure that the client is doing well. They're doing okay. Their health and safety needs are met. So we are looking at how is the client doing, and you're looking at it in general, but you also want to think about some key areas to look at. Now, this is a listing of some areas. This is not an exhaustive list. It's not a complete list of areas, but it's a list to begin to look at the different areas of health, safety, and well-being in the client's life. You want to look at their physical health and their medical care needs, nutrition and meal planning, their grooming and personal hygiene, how are they doing emotionally, their behavior, personal and social relationship, how are they relating to others, their home, their community safety and stability in those places. And you're also looking at how's the client doing with their supports and services that they're receiving. So these are some of the key areas. You've got the key question. You can look at it as a big picture, and then you can also break it down to the small picture of how are they doing in these areas. And you see that I've kind of depicted it as a wheel, that if you think about all of these areas moving as a wheel, making sure that that client's life is going well, we're looking at all of those different things. So let's start with one of the points in the wheel: physical health and medical care. This is a very important piece. So we said if we apply that a question to the client and say, well, how are they doing with this? How are they doing? So we want to know, are the client's health and medical care needs being met? And that's something that we want to look at. Examples of unmet needs or changes in health, they might include some of these things listed on this slide, like increased or onset of seizures, changes in eating or sleeping patterns, changes in mood, increased functional or physical needs, an onset or increase in maladaptive behavior. So how are they behaving? Are they not adapting well to the different environments that they frequent? What's going on? Significant weight loss or gain. Since the last time you've seen that person, have they lost weight that's significant or gained weight that's significant? What's behind that? Issues with skin integrity or wounds, pain, dental concerns, any new medical diagnoses or issues, or any medication changes or errors. So these are some of the things that you would be looking for when you're seeing how are they doing in the area of their physical health and their medical care needs. Are they doing okay? Are we meeting their needs? Is their health stabilized? Now, nutrition and meal planning. This is another spoke in that wheel that's very important in their life. How are they doing with their meals, with eating? What are they eating? You may go to their home and you might look in their cabinets and look to see, well, what do they have there? What are their staple supplies? What kind of meals are they planning? And you want to know, is the client eating healthy and nutritious meals? You want to consider the specific health and dietary needs of that client, because what's healthy for someone may not be healthy for the next person. You look at on this slide, you'll see the young lady here. She's got a salad, she's got an open face bacon and egg sandwich, and she's got a cup of soup, and that looks like a hearty meal, and that may just be perfectly fine for her. That might be a perfect healthy meal for her. But what if she's on a low sodium diet and we've got bacon and we've got tomato soup? There, that might be a lot of sodium in there. That might be too much for her. So when you see them eating things, you might ask, and you might ask the support workers, well, how are we doing with the low sodium diet? And tell me about this meal. And then they could say, oh, we planned a this is low sodium tomato soup that she's having, and turkey bacon, low sodium turkey bacon with an egg. And that would be a healthy meal for a person on a low sodium diet. So that's just an example of, you've got to be very specific and vigilant about what we're looking at. And you want to consider the dietary restrictions also, and any medication restrictions. I had a client one time who was taking a medication where they could not have a lot of potassium. And so he couldn't eat a lot of bananas, eat maybe once in a blue moon, couldn't be eating more than one in a day, things like that, making sure that you're paying attention to what they are eating, and knowing what those medical or other dietary restrictions are, what allergies they have, and so forth. So those are some things that we want to pay attention to. Grooming and personal hygiene. And this may not seem like a big topic, but I'll tell you something. If someone is not attending to their personal grooming and hygiene, that means maybe not washing themselves every day, or brushing their teeth regularly, or getting clean in the crevices the way they need to get clean. That is a prime opportunity for disease, bacteria, and fungus. So we want to make sure that our clients are getting their grooming and hygiene, personal hygiene needs met, that and one of the ways you can clearly observe, you can observe to see whether you can observe, you can smell, you can look at the state of their clothing and see what's going on with this client, and why aren't they getting their needs met. Because sometimes it's a self-care need, a self-care issue, where they themselves are able to meet those needs, but they aren't. And that even requires a conversation about that, because we can't just let them just go along without taking care of these basic needs, because these are the cornerstones of good health, um, even if they don't seem like the most important thing. We also want to know that the client has adequate tools, assistance, and support to maintain good hygiene. So if they can't shave themselves, are they getting to the barber shop where they need to go, or getting to a hairdresser to wash and care for their hair, or do they have the natural supports in place? But we want to make sure that that grooming and personal hygiene is taken care of. That's part of being in our society and being an accepted member of our society, and is taking care of themselves, and it gives them confidence as well. Behavioral and emotional health. Are there any changes to their behavior or emotional stability? So if the client is not doing well, like with their moods or anything that's going on in that emotional or behavior realm, or you're hearing things from some of the other support staff that there might be outbursts, or the client is just, doesn't seem to be themselves. They might be moody or depressed, or maybe not interested in going out the way they used to. We want to find out what's going on with them. We have to ask questions, find out, well, why, or how are you doing, and take a look. Some of our clients that are verbal, we can ask questions. If they're not verbal, we have to observe and pay attention, because this goes back also to their medications and things. Sometimes medications can cause upsets or imbalances, and we want to make sure that we're on top of that. So that's something you're going to be looking for in behavioral and emotional health. And we want to know, does the client exhibit challenging behaviors? So examples of challenging behaviors are any type of behavior that prevents them from being included in a normal setting. So if they're making outbursts, or hitting, or having temper tantrums, or any type of behavior that because of that behavior, we say, well, they can't do this now, or we can't take them here now. They can't enjoy this aspect of their life because of this particular behavior. That's a problem, and some of these behaviors need to be addressed. And any behavior that pose a risk of harm to themselves or others, any type of aggression or self-injury or property destruction, and then any other behaviors such as resisting basic hygiene, as I mentioned before, self-neglect. That's not a choice. We don't get to make a choice to say, well, no, we're just not going to brush our teeth, because we need our teeth to eat. And at some point, this is going to deteriorate our health. So we've got to address that. And we do have behavioral. So if you have clients that there have been some behavioral issues are causing concerns, some refusals that are causing concerns, we may need to get the behavioral support staff involved, and you can check your iBudget handbook for the process of doing that. Another area, personal and social relationships. So what are we looking at? We say, well, how's our client doing? Are they having good, healthy relationships with other people? Are they developing healthy boundaries with other people? When you observe them, what is the quality of the interactions? How are other people talking and treating them, and how are they talking and treating other people? What does that look like? And then are they developing valued social roles in their community? And so a valued social role is a role where other people, the client themselves, and others get to see that person being active, being a contributor to the community. It might be them volunteering somewhere, at a library, in a classroom, at an animal shelter. It might be them working somewhere. These are those higher levels of community involvement, where the person is not just a recipient of community services, where they're going to a bowling alley, or going to the library, or going to church. But these are those roles, active roles, where they're participating. So they're not just, if they are choosing to attend the church, they're not just sitting on the pew, that they might be an active member of the choir, or the food bank, and other people know them in the community. And when they develop these social roles, it's a confidence booster in themselves, and they become an integral part of their community. Others are looking, and when they're not there, where's Susie? I missed her. Where is she? Where's Anna? Where is she? She's always here to help us with this or doing that. We miss her smiling face. These are those active roles in the community. So to the extent that they are capable and interested, how are they participating in the community, and how are they interacting with others? And we also have to think about uh, some of our clients. They may need support with developing good social skills. They might need support with developing assertiveness, asserting their personal boundaries with others. Or some of them may need help with respecting the personal boundaries of other people, and having conversations. They may need this type of support. So when you're watching and you're observing them, you want to take some notes on that, and maybe talk to their supported living coach or personal support provider about some ideas of how to support them, and say, hey, I noticed Johnny, when he was interacting with such and such, this happened. Maybe he may need a little support asserting his boundaries, and helping him to know what's acceptable if people are asking him to do certain things. So it's just having that vigilant approach of paying attention to the quality of those interactions and those relationships. Now, home, community safety, and stability. This is an important one. Are they safe in their home and in the community? What's going on in that community? Are you paying attention? Maybe when that client moved in that community 5 years ago, there was one atmosphere and now the atmosphere has changed, or the environment has changed, or is there more crime or any issues like that? Are they being safe? Do they come in the house and leave their keys hanging in the door and forget to lock the door? Or, we're looking to pay attention to see, are they using safe practices, locking their door, or, is the community a safe place for them to live in? And also, is their housing stable? This has been something that's happened throughout the state of Florida. We know that housing, the cost of living is going up, and the housing stability, we know that sometimes in certain places of the state, the housing year over year, the rent has increased more than 5%. So those are things that we want to know. We want to keep our eye out for those things. Do they have safe and reliable transportation? This is another one. So how are they getting around in the community? Do they have someone that is safe, that they can rely on? And you may even want to look at that interaction between the person that they're relying on and them, making sure that that's a safe situation. We've had situations before where there might be some, it may not be as safe as one would think. You have to kind of pay attention to that. Who is actually doing the work? Who is taking this person? Are they using services where people have a background check, making sure that the people that are transporting them have a background check? Also, some clients, I had a client before who could drive himself. Okay, so let's look at that car. Is he making sure that the tires are, that the tires have air in it, and all of the maintenance? Does he have that situated? We don't want him on the road somewhere at night, pulled over by the side of the road and not knowing what to do. So helping them to even figure that out. If they have the capability, the ability to drive themselves and get around, they also need to know what do I do in case of an emergency, in case something happens to this vehicle? How do I address that? So those are some things that you really, again, notice how I am looking at the area, home, community safety and stability, and looking at the questions, how the underlying things that we need to figure out. So that's what I would want you to do and apply to each client, is look at that area and figure out, okay, how do I make sure that the client is safe in their home community, in their home and community, they're safe and they're stable. That's the whole key to this. And this was the last of the spokes on that wheel, supports and services. And similar to looking at their personal interactions, you also want to look at the interaction between that client and their service providers, and looking at how they are relating to each other, how well the services are being met. Are they receiving the services that the provider put in their plan, in their implementation plan? Are they satisfied with the services that they're receiving? Is there a sign of respect for the client? Are the providers showing respect for the client? And you also want to know that the providers are adequately trained to meet the client's needs, making sure that whatever it is that they are assigned to do for that client, they have the training and the ability to do that. So if we want the supported living coach to help the client with assertiveness and asserting boundaries, are they equipped to do that? Do they understand what that task entails, and are they able to train the person on those particular skills? So things like that. And then, do you have any concerns? That's another one, is when you're paying attention, do you have a red flag that goes off? Is there something about the interaction that kind of bothers you, or it doesn't seem like, I don't know about this. I don't know about this. You want to pay attention. You may want to see that person interacting with the client in a variety of circumstances. You may want to make a follow-up visit. You may want to ask follow-up questions and things like that. So if do you have any concerns about what is happening with that client and that service provider, you should definitely just not let those red flag anything go just go by the wayside. You want to pay attention, you want to ask questions, you want to have follow-up. Not saying that every single concern or sometimes we might get a strange feeling and it may not be anything. It might just be we got a wrong impression, but we do want to follow up and make sure that what we're seeing is that all service providers are showing the clients a level of respect, and that they are helping them to they are implementing the services as they are described, and they have the training to do so. So emergency preparedness, this is another section where we got a lot of questions. So one of the biggest areas of questions, again, the personal disaster plan. And I got one question where the person said, oh my, that personal disaster plan, the supported living coach usually develops that in the past. They've always been the one to develop that plan, but now it sounds like we're hearing that the waiver support coordinator has to develop the plan. Well, that wasn't the entire impression that I wanted to give last time, and I want to be very clear, is that personal disaster plan is a teamwork project, and the client is involved. The waiver support coordinator is definitely involved. They're coordinating the development of the plan. The supported living coach, if the client has one, is definitely involved, because they also have to include that plan in their implementation plan, and they're also a part of that plan as well. And another thing is the supported living coach, when they've done that functional community assessment on the client, the functional community assessment gives a lot of information about some of the things that we would need to plan for. So it'll talk about where the client is when it comes to understanding first aid and fire emergencies and different emergencies. So not only should the supported living coach be involved, but it would be very helpful if they bring that functional community assessment with them, and you take a look at that while you're developing that plan. And any other member of the client circle who may help to carry out that personal disaster plan, they need to be there. So I guess the intent or the background that I'm trying to explain is that this is a team process, and we don't want it to be, here's a document that the supported living coach does, they get it done, and we never think about it until like hurricane season. No, this is a very in-depth plan of what does this client need to do in the case of any emergency. It's very important that we consider it that way. Like I said, the intent is for the client to know what to do and who to contact in the case of any emergency. And that takes some time to lay that plan out, to think it through. It's a group effort. I'm not saying that the supported living coach cannot write it. If you assign them as the waiver support coordinator to be the writer of the plan, that's fine, but they shouldn't be doing it in isolation. It's a group process. It would be like you all sitting at the table, and they might be the note taker and writing down, here's the plan, because at the end of the day, the waiver support coordinator is responsible for getting that plan into iConnect. The waiver support coordinator is responsible for that plan as part of the support planning process. That's like the foundation, is making sure that a person is safe in the case of any emergencies. So I just want you to know that this is a foundational block, and we really want to consider all of the potential emergencies. We want to be vigilant and diligent about what this client may need when it comes to natural disasters. This particular person, how are we going to support them with that in case of a tornado or something? Whatever natural disaster comes, like, do they know what to do if they're in their apartment and there's a tornado coming? Do they know what to do if they have a personal emergency where they have cut their finger chopping vegetables and then they're bleeding? Do they know what to do? Do they know what to do for any other potential dangers in the home or community? So it's almost it's a very in-depth planning process, and the client may need practice drills and reviews. You may want to do some fire drills and things like that. When I worked in early childhood, the fire department, they had this little trailer that they would bring to the child care centers, and the trailer simulated a fire going off in the home. It was like a little mock home, and there would be smoke coming out, and the kids would be in there, and they would be able to understand, hey, here's what you need to do in case there's a fire. Because a lot of times little kids, when they see that fireman with that outfit on, it looks like a big scary monster. They've got a face mask on and they're all dressed in black. It's scary. So they had to teach them not to be afraid. So we also have to do practice drills with our clients to know, hey, this is what needs to happen in case of an emergency. Medication administration. This is another section that we got a lot of questions on. So medication, just want to start this section off by talking about what are the facts of medication administration. And for you as waiver support coordinators, this is so important for you to understand that all of the rules for medication administration, they're outlined in the Florida Administrative Code, FAC Rule 65G-7. And I'm not sure if you guys are familiar with getting into a lot of the rules and things like that, but this is definitely one that you need to know. You need to really understand it. You need to understand that there are certain procedures that have to be done. There's a certification process, the forms that are involved, all of that. And I'm saying this because waiver support coordinators are not required to attend the medication administration training. They're not required. I recommend it though. If you have a hard time like reading a rule and getting into it and really getting a good understanding, either read the rule, or I would say take that training. Go ahead and just take that training for your knowledge, because at the end of the day, we do have an expectation that you understand what those rules are. The client's physician determines the client's need for supervised assistance with medication administration. So it's up to the doctor to decide whether or not your client needs someone else to come in and help them to take medicine or to observe medication administration. One of the questions I got was, the client's sister comes over and helps him with medication administration. Is that okay? Sure. I mean, that's a family member. That's not that doesn't apply to any of this. That's a family member. When we become involved is when a staff member or of a provider or a provider staff member is the person that is administering the medication. So that's when we really have to start paying attention. If the person needs assistance with medication and they don't have a family member, so they have one of our providers to support them with that. So we first need the authorization to administer medication form from the doctor. That's the first step. And then medication administration providers, those are the providers that do administer medications. They're called MAPs, and they must keep an accurate log of medication administration in a MAR, medication administration record. So anytime a provider is administering medication, they must be certified as a MAP, and they must keep a written log in a MAR of what they are doing. Okay, so those are the beginning facts. Now let's get into the MAP role a little bit. The MAP administers medication to the client or oversees the client's self-administration of medication. So that's what that role is about. It's simply about the medication. And it is an official role. And here's what the person needs to have in order to do this role. They have to have a completed medication administration and validation course. They have had to have taken that course and are currently certified in it. It's certified on an annual basis. So you as a waiver support coordinator, if you've got any client in supported living or group homes for that matter, well, I'm just going to stick with supported living here. Disregard my last statement. But if you have any client in supported living that is receiving medication from a provider, that provider must have been certified to do that. They must have taken that course, and you should know that. You should have that information on every provider who is administering medicine to that client. That person also has to be validated to administer medication through the client's primary route. So if it's an oral medication, if they're just taking a liquid oral or a pill, that's the oral. But the ophthalmic is if they have like eye drops, allergy eye drops, that they must be certified to administer eye drops. They can't be certified oral and be administering eye drops to the client. They have to have someone to validate that they're able to do it accurately. That's what that whole process is about, and they have to have that certification. And they also have to have a completed informed consent to administer medication form. So it must be signed by the client and 2 witnesses. So all of these things have to be in place before someone is administering medication to your client that's in supported living. Let's say Johnny needs eye drops and Miss Janie is the personal support provider who visits him on a daily basis, who can administer those eye drops. Okay, so Miss Janie, does she have her medication administration and validation certificate? Okay, and is it still current? It's current year to year. So that's correct. That's step 1. Step 2, is she validated to administer eye drops? No. If her validation says oral, then no, she cannot administer eye drops. But if it says ophthalmic, okay, so that's step 2. Does she have a consent form from the client, from Johnny, and 2 witnesses have signed it? So all of those things have to be in place before Miss Janie gets to administer those eye drops to Johnny. And then every time she administers them, she's got to fill out that MAR. So another thing to clear up, the reason why the supported living coach is not typically the MAR, the MAP, the medication administration providers, because they don't typically visit the client on a daily basis. So it's usually a personal support provider or a provider who sees that client daily. And that was a question we got. Yes, a personal support provider can be a MAP, but remember, they've got to have all of that certification and documentation in place. What if the client's family member administers medication? I answered that before. That was a question, as I said, that's fine. We don't have to worry about the MAP role. We don't have to worry about oversight of a family member. We, as you as a WSC waiver support coordinator and both the supported living coach, you have to be more concerned about the oversight of providers who are administering medication and making sure it's done accurately. They're giving the client the right dose at the right time. So the MAP certification role, I said that they doesn't apply to family members. Okay, more about the MAP role. The SLC, support living coach, is typically assigned the oversight role of medication administration. And I say typically assigned because that would be up to you as a waiver support coordinator. Are you assigning that role to them? If not, then that's not their responsibility. So remember, it has to be assigned. The SLC is responsible, and they're always responsible for ensuring that providers are MAPs in accordance with the Florida Administrative Code Rule 65G-7. They're always responsible for that. And during the quarterly meeting, you're responsible for verifying that certification. I think an easy way to do that is for every person that's administering medication, sometimes there might be 2 or 3 service workers under one provider that's administering medication. And so you would have to verify their dates of certification for that medication administration and validation course. You would have to look and make sure you know the dates. And if you've got that information down, then you'll know when it's time for them to do it again. So you'll know what their yearly date is for recertification. Okay, so let's go into the documentation that should be in the client's record. Okay, this is for clients who are receiving medication from providers, from a MAP. Authorization for medication administration, they must have that from that doctor. Informed consent for medication administration, they must have that consent form for anyone that's giving them the medication. They must have one for every provider administering medication. Completed MAR forms. So these forms are used usually on a monthly basis. So at the end of each month, you should be receiving a copy of that for that client file. It's a record showing the medication that has been administered to them by the MAP. The drug monograph for each medication. Now the monograph is basically that little information sheet that comes from CVS or Walgreens that gives you all of that good information on the medicine, the potential side effects, adverse reactions, and drug interactions for each medication. That information, you should also have that on file in the client's file. And this is very important for you to understand, for you to read it and make sure that you understand what that medication, what effects that medication may have. So when you're doing your face-to-face visits, you can ask the client, hey, you know, have they, since they started taking the medication, had they noticed any type of differences similar to like the side effects? So for example, if a side effect is dry eye, have you noticed have your eyes been dry lately since you've been taking your medication? Are they okay? Just checking in to see that there haven't been any problems or adverse reactions to those medications. And then a record of drug counts, but we need to be making sure that the client, if the client is given medications, that every single medication, every single pill is accounted for, and that they are getting their correct dosage. And you know, if they're getting 30, then there shouldn't be 20 in there. In there, like, where's the medication going? So we need to make sure that we understand and keep a good tab of their medication. So next is tips for preventing financial emergencies. So this is a part of health, safety, and well-being, because uh, finances are the cornerstone of just housing stability and their stability in the community. Let's talk about a financial assessment. Okay, a financial assessment or a comprehensive financial assessment will identify an individual's their income, their expenses, their assets, their debts, their credit, and credit history. So if any of you all have ever sat down with a financial advisor, you would know that this is pretty typical. Someone sits down with you and they look through everything you've got going on to see what your actual assets, your income actually is, what your net assets and things like that. And it's very comprehensive. The IFP is not a comprehensive financial assessment. So what it does, it identifies income, expenses, and the assets in the client's checking and savings account. It's not going to identify debts, credit, or credit history. And that additional information is important for when you're looking for housing, because if there's debts or issues such as evictions or poor credit history or no credit history, that might be a problem when it comes to housing. So just understanding that what we ask for our purposes is just the IFP. But if you're really, if a good supported living coach who's really working with that client in the area of finances, they're going to be looking at it more in depth. They're going to be helping them to really look at their credit and their credit history and making sure everything is in place. And it's a real support to the client. And one of the questions that we get quite a bit, what if the client doesn't want to share their financial info? We talked about this last time, but I want to go a little bit more in depth to say it is so important that we explain the benefits of sharing this information with us and explain why do we want the information from them. So we want to make sure that we try to help them to understand the benefits of it. And I know I've worked with a wonderful supported living coach with the client that I had, and she was able to go through and help him with his credit, get his credit cleaned up. And he made such great financial strides in the time that she worked with him, and he began to see the importance of building up his finances and things like that. And he was very excited about that. And so a good supported living coach who has the training in this area, she was adequately trained to meet this particular client's needs. She was a wonderful asset to him. So just explaining that is the benefit that a supported living coach has, that that's not, no other service area offers that fiscal piece that supported living coaches do. That's one of the main benefits that they can offer. So let's talk a little bit more about like how you might share with the client the benefits of completing the IFP. It will be used to help find a home that meets their needs at a price they can afford. That's one benefit. And then there are several items on the IFP that they may not have considered even if they're working with a family member in their finances. The family member may not consider everything when it comes to moving, startup expenses, maintaining an emergency fund, and sharing expenses with roommates. So these are things on the IFP that the client may not have even considered. And also completing the IFP can help to determine if the client needs a financial subsidy from APD. They will not get a APD subsidy even if they need it if the IFP is not completed. So it's required to receive a financial subsidy. So let's talk about money management skills a little bit. Ideally, we want clients to take on the responsibility of managing their finances to the extent that they are able. That's important. And if a client lacks those skills, the SLC can provide assistance and training in this area. They can do that without having to take on the role of like a fiscal agent or Social Security rep payee. They can also just be an assistant to help the clients. A lot of our clients have the ability to be able to manage their own finances with support and assistance. So if we can help them to get there, that's our whole goal, is to help them to be as independent as possible in their own home. And here's a great resources that can be used. The Department of Financial Services, they have a literacy curriculum for individuals with disabilities. Please check this out. It's in your resource links. They're called My Money Lessons, and they can click on there and learn these great lessons right online. It's very easy for them to go through the lessons, and they're very user friendly. So I want you guys to please take a look at it. And this is a resource that supported living coaches they may already be using with the client as well, or can use with the client. So it could be something that they could be doing to support them. I mentioned an emergency fund a little bit earlier. An emergency fund is very important. Every person should have an emergency fund. Everyone should have an emergency fund. It is a cornerstone to financial security to have one. Any financial advisor will tell you that the rule of thumb is that an emergency fund should cover 3 to 6 months of a person's living expenses. So that's something that we want to help our clients to know, to understand and to be building up towards, because emergencies in life are going to happen. Financial emergencies are just going to happen. It's going to happen. And we don't want them to be in a position of just being at the mercy of just the winds of change in the world, whether or not it's inflation or their housing costs are going up. We want to make sure that they have an emergency fund to fall back on. And we can start with helping our clients to save $100, or once they hit that, very good, let's go to 500. Very good, let's go to 1,000, to help them to save that money. It's very important. And you guys probably already know about this, but I'm just going to mention it as well. The ABLE accounts, they are available to help our clients with savings, because we know that sometimes depending on their benefits, their Medicaid or their Social Security benefits, we have to be mindful of their asset limits. So with the ABLE accounts, the money that they save for emergencies or for big purchases such as a home or a car, anything like that, that can go into an ABLE account, and those funds are not included as a resource or asset for Medicaid or SSI. So when Medicaid is saying, oh, well, they can't have assets over $2,000, then you can say, oh, well, you know, if that money's in their ABLE account, it doesn't count. It does not count for that. And the reason this was enacted, this ABLE account was enacted, it was because people with disabilities, their families wanted this to happen for them. So they have fought for that. And it's a wonderful resource. The waiver support coordinators can also help clients maintain their Medicaid benefits by monitoring assets and income limits, tracking the redetermination date, reminding the client to keep up with Medicaid related notices and information received in the mail, and assisting the client with completing the redetermination and application process. So those are some things that you can help with their Medicaid benefits. And it's important to also know that there are, you know, we talked about if the client has more than 2,000 in assets, something you can do. We have the ABLE account, and clients working, it's called the oh my gosh, I can't think of the actual name of it, but it's, I believe it's something like the working clients, the 2019 working people with disability. It's a resource, Lord help me, but it's a resource that clients who work, they have a resource where they don't have those asset and income limits with Medicaid. And I put that information in your resources. So another thing that we need to know about monitoring public benefits, the Social Security Administration, it's important for us to know how these programs work, what are the differences between them, and how we can help clients use these programs effectively. So it's important to know that the SSI has certain limits, asset limits, income limits, and work incentives. The SSDI program, they have income limits and work incentives. We learn about all of that in the Social Security work incentives training, and it's so important for when you walk away from that training to understand and be able to answer these questions. One of the big ideas that I learned was that these programs are they're different, and they were designed for different groups of people. So understanding how those programs work and how those work incentives, there are some work incentives that overlap, but they're very different programs. So it's important for us to know those differences so we can help our clients. So let's get to the frequently asked questions. What is the certification process for a healthcare coordinator? The intent is for the healthcare coordinator to assist the client with coordinating healthcare tasks, such as a doctor's visit. That's their intent. It is not an official role. It's not something you have to be certified for. It's a role assigned by the waiver support coordinator to a member of the client support team. This role may only be necessary for clients who have complex or frequent medical care needs. So that's the healthcare coordinator role. Okay, supported living setting questions. We got a lot of questions about supported living settings, but they were very, very specific questions. If you have a specific case, I would say you can bring it to me or Liesl directly. We shared our email at the end of this presentation. You can bring it to us directly. You can share it with your supported living liaison within your region. If it's a specific case and you're not quite sure if the environment meets a supported living setting. Remember that the whole intent is that in a supported living setting is that the client receives the support necessary to live as independently as possible in their own home. The key question is, does the person need the services of either a supported living coach or a personal support provider to live in their own home? So that's a key question. But if you have a hard time with the case, you can let us know. If a client lives with their child, it can still count as a supported living setting if they are living in their own home and they have a child. Yes. Who completes the APD health and safety checklist? The supported living coach completes it and the WSC reviews it, and they both should have access to it in iConnect. So that was another question that we had. So those are all of the questions that we have. And we don't have a whole lot of time for additional questions. We wanted to take the time today to answer these questions. Liesl, did you want to say anything before we close out? And Susie will add to the chat the connection for you guys to take the test.
Yes, I think Liesl had to step out for another meeting. But just wanted to let you know, I will drop that link in the chat. And if you miss it in the chat, no worries. You should also get an email in about an hour. So, and if you don't see it, then please feel free to email me.
And I just wanted to clarify the word I was looking for earlier was the 2019 Working People with Disabilities legislation. That increases the Medicaid monthly income limit for working people with disabilities. But thank you guys so much for your time. Susie, thank you for allowing me to come back and speak on the webinar. I appreciate your help and assistance. And that's all I have today. Have a blessed day.
Thank you, Opal. Thank you so much. Thank you, everyone.